Hi class, so welcome. For today's video, we will tackle about the commonly used drugs. So to start, first is alcohol. Alcohol is a depressant. When we say depressant, these are drugs which depress or lower the functions of the central nervous system. So alcohol is a depressant. Which kind of depressant? The alcohol is a sedative. Sedative is one of the type of the depressants. So sedatives are drugs that calm the nerves, reduce the tension, and induce sleep. Okay? Alcohol also is the most abused of all drugs. Bakit? Available ito kahit saan na store. Basta hindi ka lang minor, pwede ka nilang pagbigyan na bumili ka ng ganitong alcohol. Okay? Kaya most abused of all drugs siya. Alcohol enters the bloodstream quickly and affects the judgment and behavior of the user. So, once na nakainom ka na, it will affect your judgment. Iba na yung iniisip mo, iba na yung tumatakbo sa isip mo. Okay? It affects also your coordination and response time. Medyo mabagal ka na mag-response kasi yung coordination mo, medyo mabagal na yung hindi na nag-coordinate, medyo mabagal mag-coordinate yung katawan mo sa iniisip mo na gagawin mo. Yan. Coordination, it affects your coordination kasi nga minsan, 'di ba? Paglasing na, natutumba, pagewang-gewang na maglakad, kaya ganon. Okay? Next is marijuana. So marijuana is a stimulant. What is a stimulant? Stimulants are drugs which increases alertness of physical disposition. They also reduce hunger and provide the feeling of well-being. Ito, pag ginagamit mo yung marijuana, kasi stimulant siya, so pwedeng hindi ka na gutumin. So, hindi ka kakain kasi high ka sa marijuana. They produce mental alertness and wakefulness. Yung iba, kaya nga gumagamit nito. Ang gumagamit nito, 'di ba, hindi nakakatulog. They have bloodshot eyes, namumula yung mata kasi hindi sila nakakatulog. Marijuana produce mental alertness kaya hindi siya makatulog kasi madaming tumatakbo sa kanyang isip. Okay? Marijuana is also a hallucinogen. Ano yung hallucinogens or what we call psychedelics? Okay? Hallucinogens are drugs which affect the sensation, thinking, self-awareness, and emotion. Okay? Changes in time and space perception. Another is delusions or false belief, and hallucinations may be mild or overwhelming. Pwedeng mild lang. Or depending on the dosage and the quality of the marijuana. Kasi pag mataas yung dosage ng marijuana na inintake mo, so mas mataas ang probability na mas mataas din yung hallucinations, delusions na mangyayari sa iyo na epekto ng marijuana. Okay? Marijuana is the most abused of all illegal drugs. Okay? Sa lahat ng illegal drugs, marijuana ang pinaka naaabuso. Okay? Marijuana is a mind-altering drug that causes a state of intoxication. It can affect the thinking and judgment and can cause anxiety attacks. Yan siya. So, 'di ba, kanina alcohol is the most abused of all drugs. Sa lahat ng drugs, okay, mas madami ang consumer ng alcohol, kaya most abused ito. Pero in all the illegal drugs, marijuana ang pinaka-abused. Bakit? Kasi 'di ba? Mas mura. Okay? The cost, mas mura siya, and then yung availability niya, 'di ba? Yung iba tinatanim patago lang. So Kaya nga affordable, tapos na pwede ka lang makabili agad once na may alam ka na sino yung dealer, o, 'di ba? Ganun siya. Another drug is cocaine. Illegal drug din itong cocaine. Cocaine is a stimulant. It is one of the common stimulants. Kanina, stimulants din sino yun? Si marijuana, di ba? Ang marijuana, hindi pala Ang marijuana is also a stimulant. Also, cocaine is a stimulant, but it is, the common stimulant is cocaine, marijuana. Okay? Stimulants are, ano ba yan siya? Stimulants are drugs which increases alertness of physical disposition. So, ganun pa rin siya. Ang effect ng cocaine at saka ng marijuana, same lang din. It this cocaine also reduce hunger and provide the feeling of well-being. Okay? Mag-high ka din. And also, they produce mental alertness and wakefulness. Same lang sila sa marijuana. Cocaine is a white powder that is snorted. Okay, pwede siyang snort, sniff, swallowed, smoke, pwede siyang smoke, and injected. Pwede siyang i-injection through injection. The common method is sniffing or snorting, yung sinisinghot. Yun siya. Cocaine may be found packaged in baggies, vials, and similar containers. It is frequently laid out in lines. Di ba meron tayo, anong tawag nila dun sa yung paraphernalia na, foil. Yung foil, okay? It is laid out in lines, so ilinya nila yung cocaine and then i-inhale through the nose using a tube or a straw. Ganun siya. Cocaine may cause runny nose. Ang cause. Ang effect, pag ginamit mo itong cocaine, pwede siyang maka-runny nose kasi sinisinghot mo yung cocaine. It may cause runny nose. Ano ba yan? Labas-masok. Yung bigla lang nagatulo yung tubig sa ilong mo. Yan. Runny nose. Paranoia. Paranoid. Depression. Irritability. Violent behavior. Ito talaga yung violent behavior. Once na drugs ka, lalo na itong cocaine, 'di ba? Makagawa ka ng mga violent behavior. And worst, baka makapatay ka pa. Cocaine also causes headaches or trouble sleeping kasi stimulant ito, hindi ka papatulugin, kaya magkakaroon ka ng trouble in sleeping or yung insomnia. Sakit sa ulo, headaches, ganon. So, next is what we call crack. Ano ba yung itong crack? Crack is a form of cocaine. Okay? Dangerous and deadly form of cocaine. It appears on the street as a small white, pwede siyang brown or tan pellets, rocks, or chips. It is inhaled through a pipe or similar device and is 5 to 10 times more potent than cocaine that is snorted through the nose. Mas mataas ang dosage ng crack kesa sa cocaine. Okay? Kaya mas 5 to 10 times ang potent niya kesa sa cocaine. Mas mataas ang dosage nito. Crack provides a quick, intense, but short-lived high. Okay? And then results in a need for more of the drugs. Ang effect ng crack, yung high ng crack is short lang. Okay? Sandali lang siya, madali lang mawala yung high mo. So kaya after na mawala, mag-crave ka pa ng more of this crack kasi mas madali lang yung mawala, and then gusto mo pa mag-high ulit, so gagamit ka na naman ulit. So ganito yung effect ng crack. Some of the effects of crack are weight loss, pwede kang pumayat, hyperactivity, hyper, hoarseness, and heart attack. Pwede ka din ma-heart attack dito pag ginamit mo itong crack. Okay? Crack can addict the user faster than any drugs. Mas madali ka ma-addict sa crack kasi nga 'di ba panandalian lang yung high niya, quick and intense but short-lived high. Panandalian lang siya pero yung high mo level up, yung mas mataas talaga na high. So 'di ba pag mawala na yun, gusto mo ulit maramdaman yun, so gagamit ka ulit nito. You crave for more and more and more, kaya mas nakaka-addict ito. Okay? Another is inhalants. Inhalants, di ba? Topic na natin yung inhalants. Anything that is inhaled na makakos ng high. Inhalants such as gasolina, pag amoy or addict sa amoy ng gasolina, di ba? Inhalants, glue. Meron ding addict sa amoy ng glue. Spray paints, 'di ba? Mabaho yung spray paints or itong rubber cement. Bulkasil, rugby. These are chemicals na makakos ng high when you inhaled it. Kaya nga, inhalants, they can cause permanent damage to the nervous system, liver, kidneys, and can lead to various psychological problems. Hindi lang yung katawan mo ang masisira because of these drugs, but also your pag-iisip, psychological problems. Makakos ka na ng damage sa iyong katawan, sa nervous system mo, sa liver mo, sa kidney mo, pati pa yung sa pag-iisip mo, the psychological problems. Another is steroids. Diba? Steroids, usually naririnig nyo ito pag bodybuilding. Yung malalaki yung mga muscles. Yan. Bakit? Ginagamit ito, some athletes inject anabolic steroids in order to improve their physical ability and appearance. Kasi once na ginamit mo itong steroids, maka-improve ito ng iyong yung pampamuscle mo. Yan, kaya malalaki yung mga muscles nila. And then the physical ability, mas ma-enhance pa yung physical ability nila. Steroid use can cause liver damage. Ito yung masisira sa katawan mo pag ginamit mo itong steroids. Liver damage, testicle atrophy, aggressive behavior, high cholesterol, risk of heart attack, enlarged prostate, baldness, depression, and other problems. Meron siyang sa effect sa katawan, may effect pa siya psychologically. Your emotion, magkakaroon ka ng aggressive behavior, depression. Yan. So, beware, do not use steroids. So, next is GHB. GHB is the short or the abbreviation for gamma hydroxybutyrate. GHB. It is one of the date rape drugs or yung ating party drugs, club drugs, or yung tinatawag na predatory drugs. Okay? GHB is a depressant. Ano nga yung depressant? A depressant are depressants are drugs which depress or lower the functions of the central nervous system. Anong klaseng depressant si GHB? It is a sedative, one of the sedative, okay? Sedatives and hypnotics because it induces sleep. Kaya nga ginagamit ito sa party drug, 'di ba ginagamit ito sa party or sa club, kaya tinawag siya na party drugs, club drugs, okay? Because nakaka-induce siya ng sleep. Hindi mo na alam ano ang ginagawa mo. Maybe gising ka but you do not know what is happening. Or maybe tulog ka, kaya wala ka talagang alam. Okay, ganun siya. Another drug is Rohypnol. Okay, Rohypnol is the brand of the drug that is flunitrazepam. Okay, it is also one of the date rape drug or the party drugs, the club drugs, predatory drugs. It is also a depressant. Okay, depressant, a sedative kind of depressant. It induces sleep. Okay? Rohypnol is available in small white tablets that can be taken orally, ground up in a drink, or snorted. Okay? Itong Rohypnol, 'di ba? Dati is white tablet ito siya. Okay? Pag na-slip into your drink, 'di ba? Hindi mo ito is no color, no taste, 'di ba? Kaya hindi mo siya malalaman na andoon siya, na present siya kasi no color, no taste siya. Etong si Rohypnol, pwede siyang orally, diretsyo na yung tablet yung inumin kung sa mga gusto na, yung ginagamit talaga itong drug na ito for their own personal use. Ayan siya. Orally, sila mismo mag-intake mismo nung tablet. Or pwedeng i-mix nila sa drinks. Or pwedeng snorted. Diba? Snorted is singhot-singhutin. So, kailangan pa nilang i-powderize itong Rohypnol at saka singhutin. In 1997, the manufacturer of Rohypnol changed the formula so that it turns blue or green, blue-green, okay? And can be more easily detected when added to liquids. So, para malaman, kasi 'di ba no odor, no taste, no color, etong Rohypnol. So, gi-change ng Rohypnol, manufacturer ng Rohypnol yung kanilang formula. So, nag-color blue-green na yung kanilang tablets. Kaya, mas madali na ma-detect yung Rohypnol once na ma-add sa liquid. Okay? SIECUS. SIECUS. What is this? It is the Sexuality, Information, and Education Council of the United States. The SIECUS, or this, ano ba pagbasa? SIECUS has been advocating for everyone's right to accurate and comprehensive sexuality information, education, and related health services since 1964. Nabuo itong SIECUS since 1964. So, mga advocate ito sila. Okay? Advocate ng mga rights para sa sexuality information and education and related health services. Okay. Recently, a number of drugs which have been used for the purpose of committing rape have come to the attention of the sex educators and health workers and this SIECUS. This SIECUS has issued a report outlining some of the drugs and a few helpful tips on what you can do to protect yourself. Kasi nga, 'di ba, uso na yung mga party drugs, ito mga drugs. So, may mga helpful tips sila to protect yourself from these harmful drugs. So before we end this video, let us discuss this quotation from the Seikos. So saying no to sex when you want to is a given. Kung ayaw mo makipag-sex, ayaw mo. Okay? Ayaw mo talaga niyan. Pero what if you can't say no? Hindi ka maka-no. Kasi you have been drugged. Oh. Or what if you are drugged? Like those party drugs, the Rohypnol and the GHB. Paano pag na-intake mo yan na hindi mo alam na na-intake mo pala? So, paano yan? Kaya nga tinatawag yun ng mga date rape drug kasi ma-rape ka. What if the next day you don't even remember being asked or how you got to where you are or who you were with? Kung sino-sino ba yung kasama mo, hindi mo na alam. Or worse, paano pag hindi ka na magising? It is important that you educate yourself about these drugs and learn how best to protect yourself. Kaya nga, I provided some list, diba? Yung list sa ating module na how to protect yourself. Noteworthy also is the fact that many males use alcohol or other drugs to facilitate sex. Kasi meron talagang mga lalaki na gumagamit ng drugs para gamitin sa masama, para maka-facilitate ng sex sa mga babaeng natitipuhan nila. Okay? The mild intoxicating effects of a drink or wine, beer or liquor can bring on relaxation and sexual pleasure. Kasi nga, pag once na nakainom ka, ma-relax ka and then tataas yung sexual pleasure mo, your sexual desire. But as one drink turns to 2 or 3 or more, okay? Yung isang drink, isang bote ng Sunmig, isang bote ng Red Horse, dagdagan pa hanggang nag-isang case, nagdalawang case, or pwedeng you are under the influence of cocaine or other drugs. Relaxation can turn to panic, joy, and beauty to heartbreak and regret. Imbis na ma-relax ka, mag-panic ka na. And then yung joy and beauty na maganda mag-party-party, and siya mag-turn into heartbreak and regret. Sana pala hindi na lang ako pumunta sa party na yon. Pleasure to pain. Imbis na happy kayo, happy hour yung party-party na yan, pag ikaw na rape, it will turn your pleasure to pain. Sakit sa buot. Or even, it will turn into brutality and even death. Kasi, hindi na, di ba mga drugs is mind altering talaga sila. So, hindi nila alam ang ginagawa nila. When they are under the influence, mas na-aggravate pa yung kanilang pinag-iisip o gustong gawin. Kaya, it even lead to violence and death. Okay? So, that's all for our topic for today. So, keep safe everyone. Thank you and God bless.